So case of today is that Karsanbhai is 60-year-old patient who is suffering from stroke and having steppage gait. Now we need to find out that which neuromuscular control is affected over here, because of which patient is getting this kind of gait. Option A, weak hip flexors. Option B, weak ankle dorsiflexors. Option C, spastic quadriceps. And option D, spastic adductor muscles. Now before going through these options, we need to understand that what happens in steppage gait. So we all know that steppage gait means what? That patient is lifting the leg much higher than the normal range, which means that there will be exaggerated hip and knee flexion. So we have to keep this point in consideration while looking for the answer. I am sure that till now you have understood it, but still just keep it in your mind and go through the reasoning which I am giving for each and every options. Option number 1, which says weak hip flexors. Now just now I told you all that in steppage gait we will get exaggerated range of motion in hip and knee flexion. If hip and knee flexion is more, hip flexors cannot be weak. So that is why this option definitely is not the correct option. I'm going to put a cross at it. Second option, weak dorsiflexors of the ankle. Now this muscle has very much of importance in gait cycles, especially from the late swing to the early stance. Yes, from the late swing, when you want to keep your leg down and you want to clear the foot from the ground, if your ankle is remaining in plantar flexion and not getting dorsiflexed, what will happen? The toes will get dragged over the surface, and that we don't want, and for that dorsiflexors are important. So what we will do, if dorsiflexors are not active, we will try to activate more of the hip flexion and knee flexion to avoid the contact of the toes to the ground. So yes, this option makes some sense. Because of this, yes, definitely there can be high steppage gait possible. So this option I'm going to keep aside because this looks more promising. But before that, before confirming the answer, we will see the option 3 and option 4 also. Option 3 says that spastic quadriceps muscle. Now again, if spastic quadriceps muscles are there, quadriceps muscle does what? It makes your knee going for the extension. Right? Just now in the beginning I told you all that in high steppage gait we will get more hip flexion as well as knee flexion. If quadriceps are spastic, knee flexion will not take place, and that is why this option also cannot be correct. Option number 4, which says that strong or spastic hip adductors. Now hip adductors, if they are tight, adductor muscles are going to pull your hip towards inside, towards the medial side, and because of that we might see the scissoring gait in the patient and not the high steppage gait. So that is why this option also will be wrong. And yes, my dear friends, you guessed it right, that the second option, which says that weak dorsiflexors of ankle, is the correct answer in this situation.